So today I'm going to talk about whether vitamin D supplementation may actually protect you against coronavirus disease. Now, a recent paper published in the journal Lancet talked about how their studies from Europe, and this was a recent study which was published in this journal called Aging Clinical and Experimental Research, where they looked at data from 20 countries across Europe and found that in countries that had average low levels of vitamin D, the death rates were higher. So these were countries like Italy and Spain. Whereas in countries in Northern Europe, so especially the Scandinavian countries, where the average vitamin D levels are overall higher because they have higher cod liver oil consumption and they also have more vitamin D supplementation, their deaths were lower. So this has kind of made a lot of people consider whether people should be asked to take supplementation of vitamin D to bring their levels up to normal to protect them against coronavirus disease. So does it actually prevent coronavirus disease? Now clinicians say that if you're expecting supplementation to protect you against infection, that's a fallacy, because really the only protection is hand washing, social isolation and wearing face masks. So how does vitamin D work? Well, vitamin D is made by the skin on exposure to sunlight. So you would think people like us who live in India have ample exposure to sunlight. There's too much sun all through the summer. But that doesn't happen because melanin, which is what gives our skin that dark tone, prevents an optimal absorption of sunlight and prevents the skin from making this essential vitamin, which is needed for the optimal absorption of calcium, magnesium and phosphate in the intestine, and this is what helps in bone growth and bone health. Now this fat soluble vitamin also modulates the immune response, and it prevents the white blood cells from releasing too many inflammatory cytokines, which are associated with which is a complication associated with COVID-19 as well as other coronavirus diseases like MERS and SARS. So what happens sometimes in patients who are very sick with coronavirus disease in ICU, that their body mounts a very strong immune reaction which is called a cytokine storm, and this can actually lead to the immune system attacking the body's own cells and tissues along with the infecting virus. So when your body starts attacking itself, it's an autoimmune condition, and it leads to the patient getting sicker, and it leads to death very often. So let's look at how many Indians have a vitamin D deficiency. So a recent study which was published in the British Journal of Nutrition on March 25th found that about 55% people overall had a vitamin D deficiency, and these are like 1,500 people who were surveyed in urban Chennai, which is again a very sunny part of the country. And what was even more worrying was the fact that about 63% of the people with diabetes had vitamin D deficiency, 58% people with pre-diabetes had this deficiency, and 80% obese people who were surveyed were deficit in vitamin D. And women had a 1.6 times higher risk of the vitamin D deficiency compared to men, although the study observed no increasing trend related to age. So studies, like I said in the past, have linked vitamin D deficiency with respiratory tract infections, and they found that toxicity is likely to be low because vitamin D is a vitamin which is fat soluble, so the body stores it. If you have too much of it, it can lead to toxicities. But if you take oral doses which are prescribed by a doctor, you should be fine, especially if you're deficit. But there are chances of contraindications. The chances of side effects are much higher in people who have kidney disease or liver issues, because then the body has a problem excreting this essential vitamin, so it should always be taken on prescription. So what we do know is that it reduces the inflammatory response, but whether taking supplementation actually protects you, well, that's not established. Doctors say observational studies cannot be used to recommend this vitamin, but if you're deficit and you take this vitamin, it's going to help you anyway. So just ensure that you have optimal levels. The supplement is is cheap, affordable, easily available, but do not expect it to protect you against coronavirus disease, although it will bring several benefits. If nothing else, your bone health will get better, and it may protect you against other infections. But coronavirus disease, the only way out is masks, hand washing, and social isolation.